On today's video, we will talk about psychotherapies. We will see what are the main types of psychotherapy and how they can help individuals or groups of people to better deal with their issues. Psychotherapy is a type of treatment, just like medication, surgery, or physical therapy. It is specifically used for treating mental health problems, or in a more general way, in order to help people discover themselves. Psychotherapists are trained psychiatrists, psychologists, or other mental health specialists. So psychotherapy is based on verbal and non-verbal communication, as well as on the very therapeutic relationship that develops between the therapist and the client or patient. During psychotherapy, you can learn about yourself, your personality, your issues if you like, your anxiety, your moods, your feelings, thoughts, and behaviors. You can understand how all of these elements are actually related to your past and how they affect you in your present. In this way, you can clearly identify your problems. You can develop coping strategies and more efficient defense mechanisms and regain a sense of empowerment and pleasure in your life. Now, a question that you may be asking is, which are the main types of psychotherapy today? Well, that is an interesting and very large topic. There are more than 70 different types of psychotherapeutic approaches today. More and more new types of psychotherapy emerge every few years. The vast majority of them is inspired by one of the three main schools of thought of psychology. Each one of these three schools contains different subtypes. In some cases, psychotherapists of different theoretical backgrounds may understand and treat the same problems in completely different ways. So, here are the three main axes of psychotherapy that you will most probably encounter where you live. The first one is psychodynamic therapy. Psychodynamic therapy focuses on uncovering the unconscious roots of your symptoms, or in other words, on trying to help you understand the meaning that is hidden behind your current symptoms, or the role that they are playing in your everyday life. Our symptoms, according to psychodynamic therapy, may have symbolisms, may be connected to our post-traumatic experiences. Now, this type of therapy is also based on the notion of defense mechanisms. Defense mechanisms, or defenses in psychology, are simply put the compromises you've learned to make in order to defend yourself against painful thoughts or emotions, sometimes without even knowing it. For example, someone who grew up with an abusive parent may unconsciously find it difficult to engage into intimate relationships, and so he may be avoiding them altogether out of fear that all close relationships will involve a domineering partner as well. By becoming aware of such aspects of your present life and linking them to your past, you may find it easier to overcome your obstacles. Psychoanalysis was historically the first form of psychotherapy. It was developed by Sigmund Freud, and it is also today one of the main forms of psychodynamic therapy. The second form of psychotherapy is cognitive behavioral therapy. According to this approach, psychological problems are based on cognitive distortions, or in other words, on faulty or unhelpful ways of thinking, which lead to unhelpful and dysfunctional behaviors and emotional responses into our everyday lives. So, according to this school of psychotherapy, psychological problems are based on learned patterns of unhelpful thinking and behavior. People suffering from psychological problems can learn better ways of thinking, in other words, to correct their cognitive patterns and strategies in order to deal with their behavioral problems like phobias and addictions, thereby relieving their symptoms and becoming more effective in their lives. Cognitive behavioral therapy was first developed by Aaron Beck. The third type of psychotherapy is systemic therapy. Systemic therapy approaches all psychological problems of individuals as a result of dysfunctional relationships with other people. Therefore, it tries to understand the individual problems of a person as a result of a problematic and complex web of relationships with his family, with his spouse, or friends. It focuses on the way individuals interact with groups and on analyzing and understanding these interactional patterns and dynamics. With this approach, what's important to understand is the very relationship and what is being exchanged verbally and non-verbally between people, and not so much the observation of the isolated individual. Systemic therapy has its roots in family therapy, or more precisely, family systems therapy, as it later came to be known. In particular, systemic therapy traces its roots to the Milan school of Mara Selvini Palazzoli, but also derives from the work of Salvador Minuchin and other famous therapists of the 20th century. We know today that all three main psychotherapeutic approaches are equally efficient, and their results are evidence-based according to science and studies. However, different types of therapies seem to be better suited for different types of disorders, like cognitive behavioral therapy for phobias and psychodynamic psychotherapy for depression. However, there are some scientists that question this aspect and actually believe that all types of psychotherapy can address all types of major psychiatric disorders equally. They underline, however, that the efficacy of psychotherapy largely depends on the patient's willingness and ability to commit, as therapy, in most cases, is a long-term relationship, and to the therapist's experience and unique style. It is also true that not all therapists are suited for all types of patients. For example, a therapist that has recently lost his spouse may not be able to help a patient who is also dealing with loss at the same time. It is also important to note here that there are different settings of psychotherapy based on the number of people who take part, the goals, and the methods used. This is true for all three schools of psychotherapy that we mentioned. So, here are the different formats of psychotherapy. A. Individual psychotherapy. This therapy involves one patient and one therapist. It is the most popular form of psychotherapy. B. Group therapy. In this form of therapy, we can have two or more patients at the same time. We can also have more than one therapist animating the group. In this therapy setting, patients can share their emotions and experience with each other, understand better how they function in a group, and develop social skills. C. Couples therapy. This form of therapy is addressed to couples who are in a relationship, married or not. One type of couples therapy is marriage counseling. The goal of this approach is to help couples understand their relationship problems, take decisions like staying together or not, having a child or not, dealing with their broader family members, and improve the couple's relationship. Although the focus of couples therapy is on the couple, most of the times there are individual psychological problems of one or both parties that need to be addressed too. D. Family therapy. This type of psychotherapy is designed to address specific issues that are affecting the health and functioning of a family as a whole. It can be used to help a family through a difficult period, a major transition, or other mental or behavioral health issues in family members. Because family is a key part of our everyday life and of the team that helps people with mental illness get better, it is sometimes helpful for family members to understand that their loved one is going through, how they themselves can cope, and what they can do to help. It is finally important to say that psychotherapy adapts to the patient's history and diagnosis. For this reason, depending on the particular context of the patient, psychotherapists may be supportive or neutral or confrontational with their patients, or they may adopt different styles depending on the situation, and this to a smaller or larger degree. The psychotherapeutic treatment used for someone suffering from schizophrenia is not the same as for a person suffering, for example, from a mild phobia. So that's it, guys, for today. If you want to know more about one of these elements, please let me know by commenting in the comment section below, and I will be more than happy to answer, or maybe even create a whole new video on the topic. Thank you for watching. If you liked my video, hit the thumbs up button and subscribe to my channel.